behalf of Indian Institute of Corporate Affairs, which is a think tank of Ministry of Corporate Affairs, and it has various schools and centers related working on corporate affairs subjects under the able leadership of Director General and CEO Dr. Samir Sharma. And also in collaboration with AVPN, we have organized this virtual dialogue addressing the crisis through solidarity and partnership. So I welcome you, all the participants, all the speakers. Thank you very much for participating in this virtual dialogue. Now, just to begin with, I will just share that how the session is planned. So since we have four renowned speakers with us today, we will be hearing all of them together. I mean, all of them one by one, and also we'll be taking up the questions from the participants at the end of the one speaker. I mean, so one speaker after finishes his talking points based on the questions, we can definitely ask more questions. So with this, I would also like to briefly, introduce the speakers, although all the four speakers are very renowned speakers we have today. We have with us Mr. Amit Chandra, who is a chairman of Bain Capital India. He will be speaking on a shared value mindset position to sustain, compete and thrive in global and domestic markets. Welcome you, sir, for this dialogue. We also have with us Mr. Anshu Gupta, the founder, Director Goonj, public-private. He will be speaking on public-private partnership and civil society responses to COVID-19 and opportunities. We very much welcome you for this dialogue. We also have with us Madam Madhu Khetan, Programme Director, PRADAN. She will be speaking on addressing the impact of the pandemic at local and national level through public-private partnership. And certainly we have our fourth speaker, Shri Gyaneshwar Kumar Singh. He is a Joint Secretary, Ministry of Corporate Affairs. For all the speakers also, we have a certain time limit for each speaker so that we get the opportunity to listen all of you. So there are 15 minutes and then 5 minutes of question and answer. So with this, probably I would also request all the speakers to please switch on their videos as well so that we can also, thank you. So, we all know today that businesses are grappling with the unforeseen crisis and trying to mitigate several challenges in today's current pandemic. However, as a part of commitment to rise to the occasion when the nation needs it the most, corporate sector in India has stepped up to support the efforts in various ways. Corporate social responsibility programs are now directed towards COVID-19 preparedness and response. Through philanthropy, corporations provide direct donations or in-kind support. Through advocacy, corporations have the capacity to shape public policy. Through corporate social responsibility programs, corporations use their many resources towards the benefit of society. And through shared value creation, firms develop profitable new products and services that address unmet societal needs. Well, on the other hand, the civil society in India has also came forward to fill the void in service delivery and human resources during such times of uncertainty. The civil society in India is a vast network of organizations working upwards from the grassroots level. They participated in relief and rehabilitation practices and worked with the state and central mechanism supplementing their efforts and work. We all agree that the fight against COVID-19 needs as many hands as available, and the job is certainly too big for the government to handle alone. Therefore, the strategy is to leverage the vertical and horizontal partnerships. The vertical partnerships which the stakeholders have built within their organizations, and horizontal partnerships which the government has institutionalized with stakeholders. The manner in which stakeholders have responded to the pandemic reinforces the power of partnerships. And with this, without taking much time, I have a pleasure to welcome again Mr. Anshu Gupta, popularly known as the Clothing Man. He is an Indian social entrepreneur who founded Goonj, a non-government organization headquartered in Delhi. Asia's Nobel, the prestigious Raman Magsaysay Award 2015 conferred to him, credited him for his creative vision in transforming the culture of giving in India. His enterprising leadership in treating clothes as a sustainable development resource for the poor and in reminding the world that true giving always respects and preserves human dignity. So it's a very brief introduction, and I'm sure he's well known to all of us. So with this, Mr. Gupta, I would, at the beginning, this is your experience and expertise. I would like to put up two important questions for your kind consideration. First being, well, we know that COVID-19 is a great shock to the society, to the health system, to the economies and governments worldwide. In the midst of extraordinary challenges and uncertainty, leaders of various organizations are under tremendous pressure to make decisions on managing the immediate impact and the consequences of pandemic. So, in your view, how can civil society organization, CSOs, augment the efforts of businesses in health as well as non-health sectors to build a more sustainable world for the years to come? And just to add on to this particular thing, if I can also request you to also reflect on what are the ways to communicate to funders and various stakeholders to make sure that operations are smooth during the implementation phase of a social intervention in this crisis time. So over to you, Mr. Gupta. I request you to kindly take over from here.
Thank you. Thank
Please
you.
take a 1 minute, sorry, but we have our esteemed speaker, Shri Gyaneshwar Kumar Singh, sir, Joint Secretary, Ministry of Corporate Affairs. And he's kind enough to, really take out time amidst his so many meetings and busy schedules. Thank you very much, sir. We welcome you, and we will be very privileged to listen. Yes, Mr. Gupta, please.
Okay. So I think first the larger world, especially this country, also need to understand that it's not just a health crisis, right? I mean, health is one component of it, which is extremely important, and it started with a health crisis, but now it's more of a hunger, more of a sustainability, more of the employment, more of the economy. There are huge amount of related crisis, and to be honest, many times when these dialogues happen, I always compare it with the health disaster in a family. So these days, the moment head of the family or someone really, get sick, and then you see that how the entire economy of this family, the piece of that family, is really distorted. So that's how this is happening in the entire nation. And a lot of people spoke about India, that the strength is informal economy, but I feel that is one of the biggest problem right now, that we have been running this informal economy, and 80-90% of our workforce, especially the migrated community, come to the informal economy, which might be helpful in running the economy in the peace time. But if you see the crisis on the individuals who are a part of this informal economy, where their wages are not secure, where the jobs are not secure, where just on one fine day they start walking hundreds and thousands of kilometers. So it is much more than the health crisis. I think let's just understand that, and it is parallel to the health crisis what is happening right now. It is extremely good to see that how civil society really responded to it, and that is something not new for the civil society to respond, to be honest. I mean, my understanding about this disaster is that a large part of these issues were in any case were there in the world, or in the nation. So we had migrated population, we had poverty, right? We had a lot of other issues which were there. We had we saw civil society playing an extremely important role in the nation building. It's just that we were ignoring a lot of these components, and suddenly every single thing became visible. Fine. Now, it's good that we work together in different sectors, and it is good that we are thinking to work together. But before that, I would say that now we need to change the game a little bit. Right? I think we need to understand that the arrogance with which people like me were coming, that is completely shattered. The arrogance of speaking in English, the arrogance of knowing everything, the arrogance of having a good car and vehicle and house and all that, all is shattered, because now after 3 months inside homes, we all know how the world operated. We all need to really change the language which I have been advocating of donor and beneficiary. I mean, after 3 months or maybe more now, we understand that people like us who have come from the best possible institution of India or abroad are the biggest beneficiary, and the givers are actually the farmers and the laborers. Because someone who made my house is homeless, someone who has been feeding me is forced to ask for the relief. So extremely important, whatever sector work together, whether it is government, private, public, whatever, that the people at the end of the day, we all these institutions are run by the people. That how do we make sure that people like us come out of this arrogance? How do we make sure that, especially in this crisis, we listen to the grassroots instead of imposing our own agendas that this is how the development should happen? I mean, we see the topmost economy, topmost system, topmost healthcare systems. Every single thing actually is shattered in this particular. Just a small invisible virus really shattered everything. So I think it's extremely important for us to come to the level and say, boss, something went wrong, and there is no harm in accepting that, right? Because as we are saying that the new word post COVID, I am saying the new word with COVID, right? And and we have to live with this new word with COVID. We don't know, when is it going to happen. We don't know when the vaccination happen and when the last person on this earth will actually have access to that vaccination, right? So it's not that tomorrow if you find a vaccination is going to give you a solution. That will take its own sweet time. So how do we redefine the working together? How do we redefine our thought process? How do we say that in a country like India, agriculture is still the most important sector? How do we say that the farmer is not an unskilled person? I have been saying this again and again, that someone who is growing 200 different kind of rice or 100 kind of rice, how can you call that person an unskilled person? Why do you think that when you bring that person to the city and make him a plumber, and then suddenly you start calling him skilled? Because this is our arrogance, this is our need. uh, as far as partnership is concerned, I have a couple of things. One is that the governments must accept and give due recognition to the development sector, because this particular disaster, again, it became absolutely evident that how the smallest possible institution really took risk. uh, Even the many of the doctors of the biggest hospitals were not on the road, but an average person from the development sector, just because of his or her passion, was on the road, or average citizen of this country was on the road to support people, to stand with the people in problem. So government must recognize that this is a very valuable system. This is not run by the people who didn't get a job somewhere else, but this is actually run by some hardcore professionals, very passionate people, and who understand the core of the nation, because they spend a considerable time with the communities. They spend a lot of time with the Indian villages and in the slums. So they understand the pulse of this nation. That is number one. And the relationship also has to be of equal, where it's not that the donor or the corporate is a the government or corporate is a donor, or the NGO is a beneficiary. No, NGO is the civil society is an expert agency. The way, if I want to run a corporate, I might completely fail. I might run a very successful social enterprise, but I might, if I get into the corporate sector, I will fail. Similarly, the other stakeholders need to understand that this also is a very challenging job. It needs a lot of wisdom. It needs a lot of experience. Charity maybe all of us can do, but the development is not possible by each one of us. I mean, that's a science. That's an art that needs a lot of experience, right? Similarly, if I talk about the corporate sector, I would say that especially in the CSR Act, when we talk about this notion of proximity or distance, must go away now. That's the wrong interpretation of the law, where a lot of people sitting with money still think that the problems are in Gurgaon or Gachibowli, and we have to do everything around Bangalore or Gurgaon. It doesn't operate like that. It's extremely important to kill the mosquito instead of treating malaria. So let's go to the villages of India, which in any case had pool of talent which we didn't recognize. Now they have added talent, which is gone from the cities. This is a golden opportunity for all of us to go there and work together. And my last point about the civil society, the civil society itself needs to understand that much more than the NGO sector, which is sitting in Delhi, Mumbai, Bangalore, people like us, uh, we also behave like donors within the sector. It's important to value the wisdom of the grassroots where we all operate, because these are the last mile connect. If we keep paying ASHA worker equivalent to the salary of a part-time maid, fine, or not even the salary of your gatekeeper, the systems will not improve when we talk about the health system. So how do we really redefine, relook at the entire process and humbly accept that something went wrong, and there's no harm in that. I mean, something happens in our own institution or at our own home, we do a chidfar, fine, we do some analysis of that and then come out with solutions. So I think I'll stop here, in the in the respect to just to keep time, and open for any Q&A or comments.
So, Mr. Gupta, while we agree your focus on the principles of safe living and achieving the sustainable development plus goal, but here's a one question that due to the physical distance that humans have to maintain as of COVID-19, we are experiencing an unprecedented boost in decentralized work and telecommunications. And this will accelerate the transformation and further increase complexity. How can we see as civil society benefit from this boost in the future? Or how can civil society boost in digitalization to save our environment and increase social justice?
Listen, I think these are phases in the history. So if we have to go ga ga about technology, we have been doing that. But the fact also remains that ultimately what you need is not just a telemedicine, but a doctor to attend you. Because I went through myself as COVID positive, so I understand how much it is important to have a physical connect also. Fine, this disaster will stop that for some time, and we are hoping that the day will come when we can actually openly hug each other, and that day will eventually come. Yes, the telecom boom and everything is good for building your processes and system, but one thing which this country certainly needs to understand, that there was something which was missing, and that was the emotion and the human touch. If we were very strong in emotions, if we were very careful about the relationships, these millions of people wouldn't have started walking on one fine day, despite knowing that they don't know the destination, and the route is extremely tough. So somewhere, yes, civil society will benefit in terms of process and systems, but civil society is one extremely important link, direct physical link, emotional link with the people. And I'm just looking forward to have that, right? In the remote villages of Girdi and all, right now, Big Basket and many other portals will not deliver. These are, we, the privileged people, will get it. That is where people like us will have to go physically and deliver something. It's very simple. So I think let's let's see that what technology works, and how we improve our systems and processes and all that. But let us not say that this is going to be the only solution, because just before COVID, large number of people were paying to the consultants, of for the de-addiction of the mobile and laptop, for their children. So suddenly those things can't become so useful and so beautiful in life. Right? It's a compulsion that we have to go to these gadgets back again. But let's also not let's understand that there is importance of understanding the value system and emotions of each other.
Thank you, Mr. Gupta. We really appreciate that the hardest hit are the poor in developing countries, where already struggling workers do not have the benefit of social safety and the stimulus packages. And governments around the world are racing to implement economic stimulus and support packages to keep individuals, businesses, and economies afloat. While supporting their urgent implementation, we must ensure that these measures pave the way to a more sustainable economy. So, thank you very much for sharing your very frank views on this. Now, since I have to make a one change in the sequence of speaker, as GK Singh sir has another meeting also scheduled shortly. So, I will now move on to Shri Gyaneshwar Kumar Singh, Joint Secretary, Ministry of Corporate Affairs. Sir, civil society and volunteering and NGOs, they constitute the backbone of the collective articulation of citizen interest in a democracy. And surely they can prove to be an asset in our fight against this pandemic. And while the government seems to appreciate the potential of NGOs in addressing the immediate aftermath of the lockdown, the need is certainly to foster a complementary and collaborative engagement which looks far beyond. So, sir, can you please share the government initiatives and how the relevance of public-private partnership in providing regular feedback to the different state and local governance institutions for socio-economic development of the nation?
Thank you, Dr. Garima, for inviting me, and fellow panelists, Mr. Anshu Gupta, Madam Ketan. I think Mr. Amit Chandra is also there. We have worked together on high-level committee report. This is a challenging time, and what Dr. Garima has asked, Dadish has asked, what is the role of civil society? So I think this pandemic has some way established that in society, civil society has an important role. Without civil society, delivery of public goods will always be a challenge. But Dr. Garima, you have raised the question. The role of civil society, it is not the government which has to recognize. Government is recognizing. It has been established by the practice where the civil society, they have come in good numbers and they have taken the responsibility of last mile connect. And last mile connect, whatever they have done it, but still there is a lot of scope for developing this partnership, this cooperation in such a way that whenever we face not only pandemic, in normal case also, in normal day-to-day business also, how the civil society, NGOs and the government, they work together. Because this, if you see this pandemic, I'm not going to talk about much on the CSR, not to talk much about what the Ministry of Corporate Affairs has done it. If you see this pandemic has some way exposed the fault line in the society, which was some way we thought there is no fault line, but when we started experiencing, then we realized that we have experienced that informal economy. Government tried to do much more that whether it's a PDS, direct transfer of the money, and all kinds of measure. Whatever government did, some way it was not enough. So what is the main lesson we have gathered from the pandemic? If we look at the business, which is the mandate of our ministry, we always discuss that the business is for society, and Gandhiji concept of trusteeship was that the business, who are the stakeholders? it is not the shareholder, those who are working, the society, everyone is the stakeholder. And in the Companies Act, if you read the 166, we have defined for the first time, I think, anywhere in the world, in the code itself, in our law book itself, we have defined that the business shareholders are not only their immediate those who are investing money, but the community, the employees, the environment, all are stakeholders in the business. And this debate we started in 2013. Now, last year, 2019, there was a big conference of top multinationals, around 200 CEOs. They gathered in New York. They have also recognized this fact that the business is not for shareholder, it is for a stakeholder. Why it is for a stakeholder? The core issue is sustainability. So if business has to be sustainable, it has to look after everyone. What we have seen during the pandemic, some way, in spite of the good business, they have come up, they have tried to do lots of good things. Government has also started, but still there was a gap. And the gap has manifested in suffering of the common people. And now you realize that you will find that the labor exporting states, this may not be reported in newspaper. Now the business organizations, they are sending people, please get them even the flights ticket they are giving. So somewhere now, what was there in the book, what was there in the practice for most of the business organizations, those who have lost this concept that even the labor is part of the business, they have started realizing that. And we are very hopeful after this, we don't have to tell anyone from the ministry that labor is a part of the business, because if you go to Chandni Chowk, you go anywhere, their productivity has been compromised because labor is not. So this is the big lesson which has come, that when we started reading about the capitalism, we used to think that three things are important: labor, capital, and market. Market is still there, capital is still there, but without labor, the business cannot run. So this is very important lesson. There are 3-4 lessons we can think about, that what pandemic has given, not only has given, people has internalized. People has internalized this stakeholders concept, because if labor is not there, neither they can make money. And this was as foresighted for those business people. Like I read somewhere Azim Premji's statement that this is not time to go for a labor reform. There is Azim Premji is saying, many business organizations, they say we are not going to cut the labor salary. So they were far-sighted. Those who have missed this vision, they thought that they have to save on the labor. They are now repenting. So I think pandemic has given the lesson that you have to think in the stakeholders, and you have to keep. And once we talk about the labor, then the social security comes. Then the public delivery system comes. What Mr. Gupta was saying, that how the connect can be developed, because this without this large last mile connect, we always have a challenge. And whatever government has announced, all of us face the problem of reaching to the marginal sections of the society. And there are two ways of looking at it. They have suffered also during this pandemic, but they were the one who showed humanity. If you see on the roads, there were people, they were distributing free foods, they were working for others, they were giving waters. So everywhere, the people, those who were marginal sections of the society, those who were struggling for their existence, they were in the forefront to help others. So the community feeling was evident everywhere, and something which has happened for urban persons like us. For the first time, we have realized the concept of the bond. We have realized the concept of others in our life. So RWA, because it was such a problem, Resident Welfare Association, people started talking to each other. So what in this mad race in 10-15 years, we lost the touch that when we are running for our life, we are working, we need to care about others. That has also started. Many of, like Mr. Gupta said, he was a COVID positive. Many COVID positive were helped by the neighbors. There were some bad experiences, but we have to think about the good experiences. We have to some way showcase those good experiences. We are not going to get anything from the bad experiences. Second was, this pandemic has some way put a challenge to the policymakers. Development for whom and how the development should take place. So people have seen, for the first time, we have seen the green skies. We have seen the pollution level coming down. So now there is a conscious effort. We have to put this ecological factor, environmental factor in each of our policy, because something is always said, something we experience. So experiential learning is always, I think, a permanent. So all of us, those who always thought that whether development is good at the cost of environment or both can go together, this pandemic has really given us a lesson that the development and the environment, they are not contradictory to each other, they can go together. The another issue which is very, very important is social security. We always thought that we have lots of social security framework, but there is a question mark, there is a gap. Those gap has to be analyzed together, and we have to work together, whether it's a migrant worker or others, those who were, in spite of government was willing to distribute ration, whom to give it. That was a problem, how to identify, and this is the gap. If we have an organic link with the civil society, this link can be, this link can fill up the gap. Second policy issues is the public health system, because Mr. Gupta has summarized this crisis was not the public health system. This crisis is the development debate. Like what we are saying for health also, somewhere in the West also, you have seen the country, which country has a public health system, they were able to respond in a better way. The countries which has thought that market would look after everything, they have suffered badly. We are a country where initially we had given lots of focus on the public health system. Somewhere we realized that public health system is costly in the sense for the government, not for the patient, but we cannot replicate or we cannot reach to the village level. So we started working on, or even in city, market mechanism. So market mechanism is good, but it has its own limitation that has been exposed. That's another lesson for the public health system. There should be mix, but that private health sector has a role, but the public health sector in a country like us and many other countries, developed countries also, I'm hopeful after 1 or 2 years, we'll see those debates and literature that they will also realize the importance of public health system. There is another important issue. I can talk about that issue from the Ministry of Corporate Affairs. You have said, Mr. Gupta, that where the CSR should be used. That's a big debate. There is a misnomer that it should be in local area. So we are saying that this is not a mandatory, because with the advent of our service sector, we can't say which is the local area. Which is a local area? A local area concept came in 2013 when Mines and Minerals Development Act was not there. Now there is a separate act, and the companies are contributing. The extractive industries, they have this concept. You are some way affecting or destroying the local ecology. You are trying to utilize the local resources. You have to do these two things are different. So CSR till now, it has very good, if you see, it's a mixed reaction. There are good example, bad example. So in CSR, what we have seen in CSR, right now kitty is very big, but it is mostly in the developed states, the needy states where it should go, whether it's our aspirational district, Northeast, or this whole Bihar, UP, it is not going much. So we have to do the advocacy. We are doing, national award has been constituted where we are giving this regional voice. If some corporates are doing good in a particular region, we are trying to encourage that through the best practices. From the ministry side, we have cleared that concept that local area is, we had a meeting with the public sector enterprises and we said, show me where we have defined the local area. We have said the preference was decided in 2013, and that is no more relevant that way when Mines and Minerals Development Act has come, which works only in local area. There is another question is, earlier we thought of the CSR, initially the idea was we have to create enabling environment, we have to do the sensitization. Now we are going for a new rules where we are trying to some way give a push to the transparent ecosystem. Some way we are trying to ensure that some way the big expenditure, big companies, 10 crores and above, there should be some kind of impact assessment. We are also trying to come up with a solution. Whatever you are doing as a company, it will be mandatory to that you put it on your website. We are thinking also to come up with the exchange portal. Exchange portal is the idea of the questions what Mr. Gupta has said, that CSR should be demand driven. It's not be I have to spend 2%. nearby areas in Gurgaon, you are spending somewhere, or in Delhi, my locality, you are spending. I got some proposal. Why not we develop your local park as a CSR? Well, here the government is working. This is not your area. Go to the place where there is a demand. So the demand and supply till now largely, this is one of the criticism of CSR, it's a supply driven. So what we are trying to do is that the report has come with us. There was an expert committee. Ms. Garima was also part of that committee. Now we have to work on. We are trying to develop a platform that will not be a mandatory. We have to start with the voluntary, where the corporate will register, where NGOs, implementing agencies will register, and then there will be experts like you. So we have to make CSR system a transparent system where people should get benefit. And we have to also come up with some other way of leveraging technology, so that whatever government should have a minimum role in doing some kind of a micromanagement of the CSR. The board driven process, we are trying to come up the rules how the board driven process itself that should become more transparent, more accountable. That is the CSR. But there is another debate also going on, and that is the debate, that is the answer. Because unless business is responsible, what I discussed about the stakeholder, there is no answer. And for that, we have started with the framework, which we started very early from the voluntary guidelines. Now we have come to national guidelines. Now we are coming with business responsibility reporting. Now, as a pressure group, all of us, we have to work together. Each business must declare how they are responding to the requirements of the stakeholders, how they are complying with the rule, what the government company is doing, how you are complying to the labor laws, how you are complying to the women issue, how you are complying to disabled, how you are complying to the child labor. So right now, SEBI has decided, earlier it was for 500 companies, now they will do it for 1,000. We are looking at the time will come when each company, irrespective of your profit, you try to imbibe, because once you are responsible, then there is no problem. We don't have to monitor. We don't have to face this kind of a situation where fault lines become so visible that we have to think about the policy challenges. So solution is business has to become responsible. In that framework, internationally, there is a debate of human rights and business also. So once businesses start thinking they are not accountable to the shareholder, they are accountable to a stakeholder, it will be inclusive, it will be equitable, it will be sustainable. So sustainability issue, we can address it by changing the business philosophy. That's a big job. That's a change of perception. So we have to do lots of things. We are working on it. Some way pandemic has some way put a break on the kind of work we were doing it. We hope that this time passes off. We start working with our business federation and business, how this responsible business can become a reality, where each business house, they come and they say how they are addressing their issues of the stakeholder. And at time has come, what you have said, that this is no more a question of charity. This is no more a question of donation. The stakeholder has a right over the business, and they have the right. They have to get it, and this will come through this process, because no change is a smooth change. There are good business leaders. They come themselves. They say, no, we have to take care of the stakeholders. So this is now the platform for us, where we have to, through the advocacy, whether it's a webinar, concept, we have to engage with the CEO. What was decided in Chicago meet in July 2019, businesses for stakeholders, we have to work on it. Now, there is another issue also, that is SDGs, because Sustainable Development Goal, Niti Aayog is piloting it for the state institution. Now, through the CSR, we are trying to change it. Our Schedule 7, we are trying to map it with the SDGs, so that SDG is a proven framework. There are indicators which all the private sector will start also following. And this SDG, when we talk about the SDG, it should not only spending what CSR is talking about, it should go to their boardroom, should start impacting their policy also. They should take SDG as a business opportunity. It's a long-run process. So somewhere we have to start. We have started this debate. Mr. Chandra was part of a committee. Committee has recommended. We have started implementing. We are right now in the process of revisiting the rules, revisiting the forms, and we are hopeful very soon will come out. But what you have said, that this pandemic has given a question mark to all of us. whether you are in developing country or developed world. Development for whom? What is the role of society? What is the role of family? What is the role of environment? So, and what is the role of civil society? So it has put a question mark. All of us, we have to think, if you want future which is good for us, which is good for our children, which is good for everyone. So this is the only way where we work together, whether we are working in the ministry, whether we are working in the field. Unless this connect is developed, there will be always missing links, and the government will always have the problem of delivering the public goods with minimum cost, with maximum efficiency. With that, I will not take much time. I have to join another video.
So just one quick question, sir. I'll just take one quick question. Mr. Sani has asked that, do you see development work becoming part of doing business rather than something that needs to be done from business gains and profit?
So we are not saying the business. We are saying that the profit can be sustainable only when you are sharing with the stakeholders. There are a lot of literature, you can check it, and that is the old thing that social responsibility is business to make profit. We have passed that age. This is the age where the non-financial reporting, when the investor, we are talking about the business, any investor right now coming, they are looking at non-financial, how you are addressing the concerns of a stakeholder. It's a proven framework that if you want to be sustainable, you have to look after everyone. So it is not contradictory, making profit and looking after your stakeholders. And the pandemic, you think of any business entity, those who have those business entity, those who have not looked after their level, their efficiency at this moment is 20%, 30%. Those who have looked after, they are working at 90%. So there may not be there cannot be better example than the pandemic. Those who have looked after their level, they are happy, they are smiling. Those who have not looked after, they are sending. Those who don't know, they are sending buses. You know that Bihar, UP villages, buses are going. There are the agents. They are saying that we will give you food. We will give luxury buses. We can renegotiate your level, your whatever is the monthly basis. Please come. So this situation would not come if we look after the stakeholder in our business philosophy itself.
Thank you, sir. We should certainly aim at categorizing developmental public-private partnerships according to the thematic areas mentioned under the CSR law, which is aligned with SDG goals in order to support shared goals, pool funding, resources, and ultimately shared value creation. So thank you very much, sir, for your time.
Thank you, sir. I will leave. Thank you so much. Thank you, sir.
Sure. Thank you. So we'll just continue now with our next speaker, which is Madam Madhu Khetan. Ms. Ketan is a development professional who has worked with PRADAN for close to 30 years. She is recognized for her work on institutional building and farm-based livelihood. She has been instrumental in shaping PRADAN's agriculture approach towards a market-oriented production cluster strategy. She is also recognized for her pioneering work on gender equality through women collectives in PRADAN. So, Ms. Ketan, we would like to, pose two important questions to you. The response to the pandemic was structured at different levels, starting from the essential requirement on the ground to building capacity to tackle the uncertainty in the months to follow. So, in theory, almost any project could be structured as public-private partnership. So what should be the criteria to determine whether a project is suitable to be a PPP? That's my first. And secondly, is if you can also reflect upon some of the factors that need to be considered to ensure that PPPs create the intended social impact.
Thank you, Garimaji, and many thanks for creating this opportunity to deliberate upon, collaborations. I think, this is a very important area. that the pandemic has actually demonstrated the importance of the various pillars of society coming together. I mean, the importance of collaboration has always been there, but I think the pandemic has showed us that there is no functioning, and life cannot function without greater collaboration. And first, I'd like to share a few observations about how we saw collaborations, new collaborations coming in as the pandemic, and so one is that the Samaj, Sarkar and Bazar, this trinity which is so important for inclusive development, we really saw shifts in the interrelationships between these three pillars. For example, I mean, immediately as the pandemic struck, we saw Niti Aayog's, outreach to civil society organizations at a very macro level. That was one shift that we saw, very remarkable shift. We also saw many philanthropies immediately coming forth and collaborating with civil society organizations on the ground for immediate relief activities, and kind of re-pivoting the investments available towards immediate relief requirements, which was so essential at that time. Talking also about what PRADAN has been involved in. I mean, all our professionals, and there are around 400 professionals currently across 104 blocks in around 32 odd districts in 7 states. So all these people were kind of on the ground, stationed, and through various ways, innovative ways, triggering more in situ ways of reaching out to communities, were involved in immediate measures like distribution of dry food, etc. So in all this, we saw a very varied response from philanthropies. I mean, some we found have been so proactive. Others have been like, I would say, a little, So the other changes that we saw have been at the, at a micro level, if we say, the kind of relationships between citizen groups, say women's collectives and say gram panchayats. So remarkable shift in, how gram panchayats and citizen bodies kind of collaborated to actually reach out to vulnerable families. We also saw a remarkable, outreach by the women collectives, the SHGs, in terms of, running community kitchens, quarantine centers, partnership with gram panchayats, producing masks, producing sanitizers, etc. And all these within, when conditions were so bad, all these activities were going on. We also, saw the importance of, relief measures announced by the government. For example, the Jan Dhan tranches released every month, and the kind of, the crowds that it caused in the banks in the rural areas. We also saw the importance of foods, the additional food supplies which were made available by the government through the PDS. So these were immediately during the pandemic, and but despite this, I think several gaps have been witnessed, which all of us have seen, starting with the way we kind of, we treated our migrants. But beyond this, I mean, the invisible impacts also, which kind of remain hidden, also have happened. For example, this whole the impact of and how health services were affected in the rural areas, and especially reproductive health services, the take-home rations, supplementary nutrition systems through the ICDS, etc. Were actually, I mean, we saw that THR supplies in many states were kind of really impacted, and we do fear that there would be impact on especially nutrition status of pregnant and lactating girls, young children, and the increased workload on women. So at one level, I mean, there was, with the entire family being at home, there was increased cooking, increased fuel collection, because the Ujjwala supplies were also kind of impacted. But on the other hand, there's also, a lot of expectation from women on public roles. For example, all the community kitchens, etc. We also fear that, because of the crisis, the education status of children, and especially girls, may be also impacted due to the economic situation of households being badly affected. We also also see that the digital divide is becoming so real, in the sense that school in the rural areas, school education and the studies are badly again affected. Skilling centers, again, many of our women were kind of involved in skilling programs, and many of them were in fact at centers which were out of their local area and outstation. So many of those centers were immediately closed down. The trainees were left in lurch. Large number of petty enterprises we hear, significant number have shut down as a result of the drop in demand. Even things like rice consumption, which is such a basic, has also, we heard, was impacted in the sense of the sale of rice. We also saw the banking system come under strain. But the pandemic, coming to the brighter side, I mean, the pandemic has actually showed the resilience of the rural and demonstrated a way out. So despite all the stress and the difficult situation, farmers did manage to harvest their rabi crops which were standing in the field, and have although farmers that were growing perishables and cash crops were affected by the disruption in transport and other logistics, but we also saw a lot of positive examples. For example, in Orissa, we saw partnership between Orma's Agriculture Department and OLM for disposable of, so it was called like vegetable on wheels, which saw farmers and Orma's and Agriculture Department coming together to pick up vegetables from the rural areas and sell directly to consumers. We also we hear in Bihar that the India Post kind of, and lychee farmers and India Post coming together to distribute lychees directly to consumers in the cities. So I think, and now as things are becoming, I mean, the focus is kind of now shifting from relief to building resilience. There is a need to create more secure partnerships. So PRADAN as an organization is involved in many large government programs which were functioning even earlier, but the importance of those programs has become so evident now. I'll take a few examples. So one is this entire focus on Narega, which, thankfully the government has increased the allocation to 1 lakh crores. And the importance of Narega is, very evident now, and especially we need to, and which is also the focus, that Narega is actually can go a long way towards creating assets that can provide incomes to farmers, because you can't really build aspirations of migrants only by, say, creating opportunities of daily wage labor of digging earth. So you have to also integrate a perspective of a modified labor, which can probably happen if you also, embed a perspective of creating livelihood assets through Narega. So Pradhan has been also involved in doing that. We're involved in working with governments across West Bengal, Orissa, Jharkhand, and Chhattisgarh into creating assets like, say, tasar plantations, mango orchards, just creating land and water conservation activities, etc. So, but I think more such secure partnerships are required. We need more businesses and farmers and FPOs to come together to create possibilities around contract farming, which allows more high value agriculture, high value farming to be done, because farmers don't do this because there's no security of prices, no security of lifting. So I think it's high time that this pandemic, we should now see at gaps in our legislative framework, which prevents or restricts, or there is a reluctance on the part of, we don't see that happening as much. So can we look at better legislative frameworks which allows these kinds of PPP possibilities? We also, I mean, talking of other kind of collaborations, although Anshu says that the digital, we do need the human touch, I agree. But, we also, I mean, we can't discount the importance of the virtual. So I think, I mean, we do need to think of more virtual ways also, because the new generation is also, I think, very amenable to adopting technology. So we need to build on that also. Many of our women who were in a UN Women program involved in again linking themselves to the open school system and um, taking their education forward when they dropped out of the education system many years ago. They are now shifting to more virtual ways. I see our partners on the ground adopting Zoom to take up classes with these women learners, along with NIOS itself, the National Institute of Open Schooling, has itself also shifted to online classroom, DTH, etc. So I mean, I think we really need to see how to bridge the digital divide. I mean, it's a cliche, but it's really, I think it needs to be done. So especially in health, etc., telemedicine, PPP for health infrastructure, we need to think of IT hubs in the rural areas to facilitate digital literacy and online learning. The importance is, cannot be denied. We also need to revive the entire skilling ecosystem with the, I mean, again, the entire skilling ecosystem has come to a grinding halt. So a lot of efforts need to go in to actually revive that with, allaying the fears that have been caused due to the reverse migration. So therefore, what are the potential sectors? We need to think of revival of the training centers and also direct opportunities for placement of candidates. So I think I'll stop here, and yeah, if there are any questions, happy to take those on.
Thank you, Ms. Ketan. I mean, you have beautifully captured the need to think about the decentralized model. And most NGOs and community organizations have the presence, they have the required skill and expertise to contribute substantially to a national pandemic planning and response. And NGOs are certainly an important sector that can bridge the gap between knowledge and practice. And with this current pandemic, there is an unprecedented need and also a unique opportunity for all stakeholders to play their roles in fighting this battle and be united yet diversified in their efforts. So, I mean, beautiful examples you have shared. So, allow me now to move to the next speaker we have with us. It is again our privilege to have Mr. Amit Chandra, who is a chairman, MD of Bain Capital India, and a philanthropist. He is or has been a trustee of the Tata Trust, a founder board member of Ashoka University, a board member of Give India and the Akanksha Foundation. He's a member of the advisory boards of Bridgespan India, the Center for Social Impact and Philanthropy, and Swadesh Foundation. In Bain Capital, he is a part of the firm's leadership team in Asia. Prior to this, he spent most of his professional career at DSP Merrill Lynch. He was named a young global leader by the World Economic Forum in 2007 and was on the Asia's Heroes of Philanthropy list by Forbes in 2016. Thank you very much, sir, for again joining this session. And if you can just switch on your video as well. Yes, sir. So I would like to begin, sir, with the questions as you have been actively involved, as mentioned by Shri Gyaneshwar Singh ji also, even in the high-level committee on CSR, and you are definitely a philanthropist. So during the last few years, India has undertaken some collaborative development interventions with a focus on health, education, and income generation. As a result, a number of projects with government, non-government, and CSOs are functioning, but relationship among the three sectors is yet to grow. How should business look at partnering or associating with the government for social development projects through CSR? And how should CSR leaders initiate it at the board levels? That's the first, sir. And the second question which I have is that, sir, that whether businesses should work independently or collaborate. If collaborate, then what are the challenges they face and how they can effectively plan to overcome those challenges and how it can have benefits of collaborations? Over to you, sir.
Namaste, Garima. Namaste to everybody else. Thank you so much for inviting me to be with all of you today. It's a privilege, especially being with such a distinguished set of panelists on this webinar. I think Gyaneshwar ji rightly pointed out, and I think this was touched upon by my fellow panelists as well. In many ways, the pandemic has, I think, shown us the mirror on what existed for many years. There were fault lines in our society, social fabric, and I think this pandemic has only deepened and widened those fault lines. And we now realize that the corporate sector cannot exist in isolation. It cannot take a short-term approach. It must be much more deeply woven into the fabric of the nation, and particularly it must think much more deeply about what the state of the nation is and what the state of people at the bottom of the pyramid is. And I personally, you mentioned, I've spent some time working at the Tata Trust, and I've had the privilege of being a trustee of Jamshedji Tata as well. And his philosophy was very clear that the purpose of wealth that the corporate world creates is essentially for the sake of society. And I think where we need to go back and revisit that concept. I think we can't simply take a short-term orientation on what the purpose of corporate wealth is. I think we have, for a long period of time since liberalization, unfortunately thought, uh, in more short-term objectives on wealth creation. And I think we made some progress on in terms of building great businesses, but I think we've landed up distancing ourselves from building sustainable businesses in context of society. And in some ways, the CSR bill, I think, has reluctantly forced many businesses to go back and start thinking about societal issues. But I think the pandemic will probably accelerate that. And so I think the first point that I'd like to make is that um, we now need to go back and relook at many of the issues, because we've now realized that unless we do so, there simply isn't a case for sustainability of corporate wealth creation in itself. We'll just get set back economically, and the very same businesses will actually get decimated if we do not actually address many of the issues that exist. I mean, very simply, if you do not invest, for example, in urban design of our cities, the way millions of people stay in squalor in slums, you will have pandemics. This will not be the only pandemic that we will suffer from, and that will in turn result in massive wealth erosion, apart from all the suffering that we have seen. And therefore, urban redesign and is not basically just a issue of making sure that there's dignity of how people at the bottom of the pyramid stay, but is also a question of sustainability of wealth creation. And similarly, I think we are now sitting on the precipice of the next big crisis, which will massively impact people at the bottom of the pyramid, which is climate change. But people also need to realize that as much as it will impact people at the bottom of the pyramid, it also goes back to impacting very sustainability of corporate businesses and wealth creation. And so we need to go back and look at that. Similarly, health infrastructure, which has suffered for a long, long period of time. And my fellow panelists made the point, I think Anshu made the point, rightly so, about how we pay our ASHA workers. I've spent time in one of the poorest districts of India called Gadchiroli, and I've seen how tribal women can be trained to deliver babies with the same kind of outcomes as doctors, pediatricians in hospitals and urban centers. In fact, I saw a note on a wall by the AIMS head of pediatrics, who acknowledged that in an organization called Search. If we can actually do that, and we can actually empower frontline ASHA workers who are tribals, why can't we pay them, more than 1,500, 2,000 rupees a month in districts like Gadchiroli? We really have got a long way to go, in my mind, in investing in our, frontline organizations. I think corporates can play a role in doing that. Some of our progressive corporates have been doing that for a long time, even before CSR came in. But I think there is a big, big opportunity for us. And I think corporates will now have to wake up and realize that this is about sustainability. It's not about 2% mandates. It goes well beyond, and the well-being of communities will, at the end of the day, determine the well-being of businesses. And I think it is extremely important in my view.
Right. There is a one specific question that can the pursuit of GDP targets coexist with our commitment to GDP goals?
Yes. Sorry, before I answer that question, please remind me again about the specific question when I come to it. I wanted to address your second question on collaboration.
Yes, sure.
And again, I think my fellow panelists touch upon some of this collaboration as well. I think Gyaneshwar ji touched upon this. I think Madhu ji touched upon it. I think Anshu also mentioned. I think in many ways, the response to the pandemic also shows us that without some reasonable degree of collaboration, we are actually nothing. We are actually nothing. I mean, here we were fighting against an enemy we could not even see. And yet we were completely helpless and in many ways we still are, but we have at least started making some progress in this fight. Yet the places where we were able to make a dent, we were able to make a dent because there were large-hearted individuals who essentially got together and decided to take the fight to the battlefront. Often these were individuals, and they were not individuals who had any mandate, by the way, in many cases. They were individuals who basically were really large-hearted and who said, we will fight. Okay. Many cases, they were civil society, people who basically said, we will go out and we will feed as many people as possible. When they need help, they reached out to people via social media, via WhatsApp groups, and people opened their purses to them. When the data suggested in the month of May that in 13 states, such organizations fed more people than government organizations. So this was done at large scale, as we know. So there was very active collaboration between civil society, frontline organizations, and donors. That was one form of collaboration. Then, at the other hand, we saw there was very active collaboration on the ground between these kind of organizations uh, and the government, local governments as well. For example, in Mumbai, where I stay, we would not have been able to achieve success in containment zones if these organizations did not work very actively with the BMC. So millions of meals were actually served with the partnerships that were created between these kind of organizations and BMCs on feeding programs. Okay, so there was great partnerships of those sort that got created. When it comes to health infrastructure, we know that a very large part of health infrastructure in India actually exists in the private sector. So India has been a remarkable place where, as of today, we have 1 million cases. But if we look at the, number of deaths, we are remarkably low. We are at, 3%. Despite the fact that our health infrastructure is very poor, and large part of the health services are provided by the private sector. So the fact is that the health there's been collaboration between the private sector and the government. When it comes to taking care of COVID cases, and I think that's again something that's got to be recognized. Of course, the CSR collaborations have got to be recognized, whether it is, if you see the massive ramp up that we get to see on PPEs, ventilators, again, contribution and support of all kind of food programs. It's pretty remarkable that, the collaborations that have got given, and that there may be armchair criticisms, but there have been pretty robust collaborations that we see. So I do see, when I look at it, a lot of collaborations, whether it's between businesses and governments, between people and businesses. But I think the most amazing thing that I have seen is that wherever communities have been active, problems have got solved. I think that's the big learning for us. Even in the most educated countries in the world, where literacy rates are 99.9%, where communities have not got it, the disease has taken its toll. And in a low literacy country like India, where communities are active, problems have got solved. Whether it is in Kerala or it's in Northeast or even Maharashtra, there are some parts of Maharashtra where you see great success stories where people have been able to quarantine people, migrants coming back and hold the disease in their panchayat schools, etc. Wherever communities have been active, people have been able to solve problems. And if there is one big lesson to be learned, it is we have to invest in our communities. And I think that is certainly something that I think we should carry with us, and we should figure out how to further strengthen our community networks. Sorry, I want to go to the question that you were reading out earlier.
Yeah. So the question is that should we be looking at gross national happiness and development indices more than GDP, and referring to the human development indices, for instance?
We certainly need a more balanced framework. I think this mindless pursuit of numbers is something we should question. Look, I think undoubtedly we need a more sustainable model of development. I would certainly concede that. But I think if we allow our policymakers to not be accountable for some sort of growth, because let's not forget, people are lifted at the bottom of the pyramid from a poverty perspective only if the economy grows. That's when lots of social spending numbers spending happens, and so you need a balance. I mean, you can't move away from that, but I don't think we certainly should go away from this, from measuring the health of the nation simply by how many billionaires we are generating and what the stock market indicators. No, I would rather measure the health of the nation as how much what the disease incidence is, how many people are not committing suicide, and how many people are getting uplifted from poverty every year. And those metrics would be far better metrics that I would concede. And to do some of that, we need a more sustainable type of growth, undoubtedly.
Right. So certainly, thank you very much for highlighting that given the enormity of the intervention required, the government cannot do on its own, and civil society cannot replace the vast role of the government in facing this crisis. And there are many areas also where the government is unable to reach, and NGOs and corporates have to reach there. Therefore, it has to be together. We need to find the gaps and then fill those gaps. So thank you very much for your enlightening remarks on it. Now, before concluding, I have one question for Mr. Gupta, because I think I missed earlier, which is, how is the private sector responding to the crisis of migrant workers and farmers?
I think migrant workers are now, for many people, they are out of radar now. Let's be honest about it. People think that they have now settled down back in the villages, and unfortunately, villages were never a target of this country. I mean, we have always used 70% of the population of this country to produce for the remaining 30%. This has been a gap always. And now we are sitting at a situation where you have, if you talk about the villages, you have more people and less resources. Yes, there is response. Yes, people have started talking about livelihood, and many corporate sector people also, especially the foundations have been much more active, I would say. The family foundation, the individual philanthropists, and all, they're much more careful about people in the villages. But what I'm trying to say again is that there is a normal which we have accepted in this country, unfortunately. So 12,000 farmers committing suicide, which Amit also just referred, is such a normal that we are not even talking about it. Look at today, more than 3 million people in Assam are affected very badly, and that is not a disaster in isolation this year. It's not just the flood; it is a top up on the COVID crisis. But how many of us in the country really know about it? Because that's the new normal. If small waterlogging happen in Bombay, that's the national news. 3 million people are affected in Assam. That's not even a news. So I think all of us really need to wake up to these new realities, that somewhere something went wrong and that's why we didn't respond to that. This is a time when I would say, and that's the question I think I raised, and the officer also commented on that. It's high time that the private sector really understands, the including the government and the private sector, they understand the need of the villages of India. I'm very clear about it. And when I say killing mosquito, it is that you kill the problem at the source. Even today, in 4,000 5,000 rupees, a family, a person can survive in the village. But what do that person get in say 10,000 12,000 rupees in a city like Mumbai and Delhi? Absolutely, a life without any dignity, without any resource. That's why they felt so insecure that they went back. If we are not even learning, and if we are still saying the using the word labor, that's the only word we are using. You see, for every single person who is gone from here, the only thing which we use is migrant labor. I am also a migrant labor. The topmost politician is a migrant person on this country. I mean, how many politicians sitting in Delhi belong to Delhi? How many rich people? How many NGO leaders like us, so-called? I'm a migrated person. But migrated person in this country is only the person who does not wear good clothes and who walk on the road. Not me, because my food is secured. So I am saying that fundamentally, until unless we shift this mindset, our resources will also not go to the people. We will have these double standards that I want to live, I want other people to survive. We need to come out of this. Then only the resources will flow. And I'm not coming with facts and figures because those are there in the market. I can talk about the fundamentals of it. Simple.
Thank you very much. It was indeed a very, I can say that, very intellectual deliberation as well as very practical deliberation. So I would like to conclude by mentioning that public-private partnerships can be envisaged as an ideal proposition for involving the private sector as well as the CSOs in national development agenda. And in practice as well, PPP should include a wide variety of arrangements and that need to be uniformly defined. Well, a lot has been done, but a lot more still needs to be done. And going forward, the government, along with civil society organization and the private sector, needs to undertake more concerted efforts to revive the credibility of PPP framework and build capacity within various institutions for PPP implementation. So with this, I would once again like to thank all the esteemed panelists for taking out time and sharing their own experiences. This was indeed one of the most, I can say, enlightening deliberation during our virtual dialogues. I would also like to specifically thank AVPN, Ms. Benali and the entire team for collaborating in organizing this particular webinar. And last but not least, again, thank you so much all the participants for your active participation. So thank you very much.